On this episode of Putting Possibility into Practice, we're visiting with business partners who you can find in the Greenway Marketplace by visiting www.greenwayhealth.com. We'll let you know what the marketplace is all about. We'll talk to a couple of our business partners about the product solutions that they offer for Greenway customers in the marketplace, how you can take advantage of what they have to offer and integrate it into the product solutions you're already utilizing from Greenway Health. This is Putting Possibility into Practice, and it starts right now. I'm Joe Augustinelli, Social Media Manager at Greenway Health, and welcome to this episode of Putting Possibility into Practice. If you are new to the podcast, I thank you for finding us and remind you that you can subscribe to our podcast on your platform of choice, and you'll be notified every time that we upload new podcast episodes each week, so you can stay on top of the latest news and trends in the healthcare industry, hear from some of our subject matter experts on Greenway Health products and services that we offer providers throughout the country, and also hear from providers on how they are utilizing our products and giving some tips and best practices for their peers and other providers throughout the country. On this episode, as I mentioned, we're talking about some of our business partners, two of our business partners to be exact, Otech Group and Enjoin. You can find both of them on the Greenway Marketplace by visiting www.greenwayhealth.com and clicking on Marketplace. I am Joe Augustinelli, Social Media Manager at Greenway Health, and welcome to this episode of Putting Possibility into Practice. Our Greenway Marketplace, which our customers can visit on our website at www.greenwayhealth.com, has a number of third-party solutions from companies who have chosen to partner with Greenway and provide products that integrate with our solutions. And on this episode, I welcome Nick Chesak and Jack Stern from Otech Group as we discuss ways that providers can take advantage of our partnership to streamline the patient experience. I took that right from the website. Nick and Jack, welcome to our podcast.
Thanks for having us.
Happy to be here.
First of all, for those who may not be familiar with Otech, a little bit about the company. Where are you guys based? What are you guys all about? How did you guys get involved with Greenway?
So our company is based out of just north of Milwaukee, Wisconsin. We've been there since 2004, so been around quite a while. Consider ourselves the pioneers of self-service check-in. We've had Greenway clients for about 10 years now. I can't say exactly how long we've been official partners, but I would say 7 or 8 years, something like that. So we're really excited this year. We got a new functionality into Greenway Energy, so we just built that out. So we're really looking forward to it.
And we will talk about that in a moment. But first, what are the overall products that people can find on the Greenway Marketplace under the Otech name?
Yeah, so we provide solutions for on-site check-in, electronic forms, and then pre-check-in as well. So really taking the patient, from the beginning or even before their appointment starts all the way through them actually seeing the provider and allowing all the information that either the front desk staff, nurses, or providers themselves need in order to, have a successful, not only patient experience but also provider experience as well.
And this sounds wide-ranging enough where I would imagine just from hearing specialties, just about anybody, correct?
Yeah, absolutely. Really doesn't matter. Definitely work predominantly with clinics. Also have the ability to work with hospitals as well. But really any form of clinic and any specialty is kind of right up our alley.
In this day and age, you talk about since 2004, so much has changed in now 15 years. And patient engagement and patient experience, especially with the digital evolution of healthcare has just changed immensely, and patients want not only immediate access, but obviously the patient experience is what brings patients back to providers' practices. So how does Otech stay on top of the emerging trends in delivering, the tools that will provide practices with optimizing patient experience?
Yeah, it's a great question. So we have a great team of developers, so it's kind of awesome anytime we're on a call with somebody and they want something special that, everybody does something unique. So if it's something that we don't do today, most of our functionality comes from our clients. So we'll send that off to our developers, say, hey, can we do this? And typically within that day or the next day, they either give us an answer or they already did it. So, it's like you said, it's a evolving software every single day. And, every time we're on a call, there's something different that we haven't heard from. And that's just we're very adaptive to the clients.
So by going to the Greenway Health Marketplace, we talked about the energy integration. Talk a little bit about that and how customers can take advantage of what's available on the marketplace in regards to energy.
Yeah, I mean, with Energy now, that's a new integration, and we obviously integrate with Prime Suite as well. But for the first, 9, almost 10 years of our work with Greenway, we were just working on the PM side, and now we're so excited about not only with Prime Suite but with Energy as well, is the ability to update that clinical data or EHR. So, anything from medical history, surgical history, family history, allergies, reproductive history, things like that. Patients are able to fill out that information either during the check-in, before the check-in, or even right in the exam room, and all that information is going to flow into the EHR or PM automatically in real time, so that whoever needs that information is going to have it at their fingertips.
We talked a little bit about this, but some of the features and functions of what you guys offer, and how does it stand out over competitors?
Yeah, so like Nick mentioned, we have on-site check-in, so that's going to take care of really anything that the front desk would do. So demographics, patient can update and verify their information. They can make payments, co-pays, pass-through balances. So collections is a huge advantage point for our solutions, simply because the devices ask for the payment every single time. So with a lot of overworked front desk staff and not having enough front desk staff, having those devices, making sure that you're collecting all of that data is super important. And
I would also just add to that, I think, in terms of uniqueness, as opposed to a lot of other vendors, we don't have a dashboard. We often get the complaint that, front desk staff members have to toggle back and forth between the dashboard of not only Greenway, but then their vendor. And so we eliminated that to hopefully, increase ease of use for the front desk staff, making it really beneficial for them. So I think that's a big difference. And then also the fact that we, in terms of pricing, charge per device as opposed to per provider. So in theory, that allows you to grow as a practice without necessarily having to implement more costs as well. So we're not so focused on the number of providers you have, but more your patient flow and making sure that the number of devices you end up going with is going to accommodate that as opposed to the number of necessary providers that you have.
And how does Otech work with Greenway customers?
Well, yeah, like you said, they can reach us through the marketplace. Obviously, contact us through our website. Everything that we do in terms of support, once we actually have a customer on board, is in-house, which I think is also unique. So none of our support is outsourced. If you need to get a hold of us, you can either contact your sales rep. Otherwise, you have a dedicated implementation manager. So you're not handed off to a bunch of different people throughout the process. We really put emphasis on building relationships with our clients. You have a familiar person that you can contact, whether that be through email, phone call, support ticket, at all times to get your questions answered or any changes that you need made. So we'd like to think that that's really adds to the ease of use of our solutions as well.
And if Greenway customers want to get hands-on and more information aside from seeing it in the marketplace, talk to us about some of the Greenway events that you guys will be at in 2019.
So we're trying to get out to as many as we possibly can. I know that we're going to Florida at the end of this month, Milwaukee, New Brunswick, Chicago. Not sure where the other ones are, but we're trying to branch out to most of the different areas. So if you don't see us at one, you can reach out to us, like Nick said, through our website. You can email us. You can contact us a bunch of different ways.
Yeah, and the nice thing too about that is we're kind of strategically went to places as well where we also have current clients, so we'll get to see them in person, and then also if there are other people interested, those interested potential clients can talk with a current user as opposed to just listening to two talking heads and things like that from the company, which I think is always great, to get an authentic experience from a current client.
And what's in store for 2019? I mean, it's hard to believe the first month of the year is already over. We're into February, so what's looking ahead? What's in store for Otech and its customers in 2019?
Definitely integration, just improving that over time. Energy, like we mentioned, that's really where we're pushing into the market this year. We've had hundreds of clients with different PM systems, but we're really trying to push 2019 into Greenway, both Prime Suite and Energy. And then moving forward, looking at the progress with the Polaris project as well.
Any other items that we didn't touch on that you guys want to discuss?
I think that we're just really excited for 2019. Like I said, we've had Greenway clients for 10 plus years at this point, but I think we're really pushing that marketplace this year because we're so excited about the integration, not only with Energy but also the ability to update that EHR. I think that in the past, information like that could be filled out by a patient and then stored as a PDF, which is somewhat convenient, but to have that fill out and then go right into the EHR or PM for the client, I mean, it saves everybody so much time, and it's a huge reduction in the amount of paper you have to use as a practice, or just the amount of time that you have to take to enter all of that data. So I think we're really, really excited about that and all the benefits that, like I said, when we talk about benefits, it's not only to the patient, but it's also to the front desk staff, it's to the IT team, kind of practice-wide, and I think we're really proud of that.
I want to thank my guests, Jack Stern and Nick Chesnock from Otech, as we talked about the solutions that they provide through the Greenway Health Marketplace. And for Greenway Health customers, a reminder, you can find the marketplace through our website at www.greenwayhealth.com. So Nick and Jack, thank you for joining me on this episode. And I'm sure I'll see you at some user exchanges and customer events throughout the year.
Sounds great.
Thanks so much.
Thanks for having us.
We have a new member of the Greenway Health Marketplace joining us for this episode, Mary McNerney and Sonia Trapina. I think I got both of the names correct. I'm getting the thumbs up. I know you can't see that, but believe me, they're giving me the thumbs up. So talk a little bit about Enjoin and what you guys do for providers.
Sure. Thank you, Joe. So this is Mary McNerney. We at Enjoin are very focused on clinical documentation integrity across the continuum. So a little background about our company. We've been in the business about 30 years, focused on accurate capture of documentation and coding, representative of coders, clinical documentation specialists, as well as providers. And that's very important as we move into value-based care, as I'm sure the members realize. Accurate capture and risk adjustment and chronic disease capture is very important as we move into value-based care and risk adjustment models, payment models.
And as I mentioned, you guys are a brand new member to the
Yes.
Greenway Marketplace.
Very excited.
So talk a little bit about that and how you
Yes.
guys got involved with Greenway Health.
Yeah, so as I mentioned, we've been in this space for over 30 years with our physician-led approach. And as we moved into various payment models, it became evident among our client base on the acute care side that there was opportunity to impact documentation integrity and coding and education on the ambulatory or practice management side. And so it was a natural foray and transition for us. And we're very excited to be part of the Greenway Marketplace and to support the members of Greenway with all of our services and resources.
And Sonia, a little bit about yourself and your position at Enjoin.
This is Sonia Trapina speaking, and I am the Director for Ambulatory CDI Services at Enjoin. Started about a couple years ago and came on board to design and grow the ambulatory side of the business. So a lot of focus on risk adjustment, documentation, and coding efforts.
And I know we were just recognized in the ambulatory space by CLAS. We talked a little bit about that, and obviously with Energy. So what does Enjoin do for providers and folks who may be visiting the Greenway Marketplace? Why should they hop on board?
Great question. So on the marketplace, we have 3 different offerings. We have our CDoc-T tool, and that stands for Clinical Documentation Tool. And what that is really an electronic encyclopedia of anything and everything related to risk adjustment and HCCs. So you can hop on there and you can learn about what HCCs are, why they're important, how they impact your payment, and you can dig into the detail of every HCC and what documentation you need to have in your medical record in order for it to translate to an HCC and into a payment. Another tool that we have on there is the HCC Risk Adjustment Reference Guide. So what that does, it is a reference guide, a paper version of CDoc-T. So it doesn't have all of the same detail. Obviously, you wouldn't be able to put it all onto paper format, but it is a reference guide that you can have in your office. Providers can carry in their lab pocket if they so choose. And again, it's the condensed version of all the details around HCCs. And the third offering we have on there are services. So within our services bucket, there are 3 components that I'd like to speak to for this group. One is we offer an HCC risk adjustment seminar that's focused for coding folks, for clinical documentation improvement specialists, and even for physician advisors. It is a 2-day session that focuses on chronic conditions, and it is approved through AAPC for 13 CEUs. The second tool, or service I should say, that we have is provider training. So we have different levels of training, and these are peer-to-peer education sessions. So it's an enjoined provider educating providers at your practices. And we have high-level education that we provide, general awareness education, focused education, and we target all of the different specialties.
And I was just that was actually reading my mind, and I don't even have an outline in front of me, so you're reading my mind. I was going to ask you, what types of specialties can take advantage of the solutions that you guys offer?
Every specialty can take advantage of our solutions. HCCs and risk adjustment really impact everyone. General awareness information is important. Primary care, they have a lot of skin in the game when it comes to risk adjustment. Endocrinology is another really heavy hitter, but anybody can really benefit from education when it comes to risk adjustment services.
And something I just wanted to go back on that Mary had mentioned earlier in the podcast was the healthcare's shift to value-based care, and how does Enjoin stay on top of the emerging trends in the healthcare industry and the solutions that they provide?
Mm-hmm. Great question. As a physician-led company, our physicians have years of clinical practice experience, but also have credentials that represent coding and documentation integrity. So by having that years of clinical practice experience and their credentials, as well as their presence in the industry as thought leaders, they're really right on the mark in terms of what needs to occur and happen, not only for increased provider engagement, but also as it relates to capturing those chronic diseases before the patient's admitted. Many times under value-based care, we're seeing that some of those conditions are reflective of quality measures on the inpatient side. And so having that experience of both the inpatient and the acute care side really complements a full picture for the patient regardless of setting, and really helps drive our expertise at value-based care and these payment models.
And let's talk a little bit about the year ahead as we kick off this new year. So what's in store for Enjoin and their customers in 2019?
There's a lot in store for 2019 and in preparing for 2020. So in 2019, many people may have heard that there are changes to the ACO tracks. So that's a big deal and important to understand if you're a part of an ACO or considering becoming a part of the ACO. Also, lots of changes are anticipated in 2020 for the risk adjustment methodology. So in addition to the HCCs and capturing those coefficients, there may be another layer to how risk adjustment is calculated. So it's time now to start understanding what 2020 is all about, and understanding those rules and educating your providers to make sure that they know what to capture in preparation for the rest of 2019 and 2020.
And in regards to Greenway Health Customers, you guys also take part in our user exchanges, and there'll be a couple of those coming up later in the year that you'll be attending. Which ones will customers have a chance to visit with you guys?
Yes, great. So this is our first user exchange meeting here in Atlanta. We're also attending Charlotte and New Orleans, both in April. We'll have presence there with our team and our sample resources as well. So we look forward to engaging with the Greenway membership.
What kind of healthcare challenges present probably the greatest challenge when it comes to the solutions that you guys provide?
Another great question, and I'm Sonia. I'm going to let you answer that one.
Sure.
Since you're in the trenches.
A couple of the big challenges. One, there's lots of data, and it's really hard to be able to pick apart, understand, and pull back together the data so that's meaningful for the providers. So taking that data, understanding your specific organization and what you need to educate your providers on can be a bit of a challenge. I think another challenge is once you do have an understanding for the data and what your needs are, then it is that physician engagement. And we find that the best way to get providers engaged is that peer-to-peer interaction. So once you have your providers engaged, it's smoother sailing, and that's what we aim for.
And I thank all of my guests on this episode of Putting Possibility into Practice from both Enjoin and Otech Group. And a reminder, you can find their product solutions on our marketplace by visiting our website at www.greenwayhealth.com. You can also visit their respective websites to learn a little bit more about the solutions that they offer for providers. And for more information on the products and services that Greenway Health offers to providers, you can visit our website at www.greenwayhealth.com. You can also find all of the past episodes of our podcast in our Knowledge Center right on our website. You can also subscribe to get notified of future new episodes of the podcast on your favorite podcast platform of choice. And we're on them all now: iTunes, Google Play, Stitcher, TuneIn Radio, SoundCloud, Libsyn, Spotify, and look for more platforms coming soon. I'm Joe Augustinelli, Social Media Manager at Greenway Health, and thank you for listening to this episode of Putting Possibility into Practice, the podcast from Greenway Health.